Good afternoon, everybody, and welcome to Community Conversations. Today's topic is pandemic preparedness for health, wellness, and safety in schools. Today's agenda is that we will do some self-introductions, and there will be a greeting from Dr. Joe Dragone, and we will address 9 guiding questions. With that, I am going to turn it over to Dr. Joe Dragone from the Capital Region BOCES.
Great, thank you, Jerry. Good afternoon, everyone, and I want to welcome everybody on behalf of Dean Jason Lane from the School of Education at the University of Albany. As you look out your window, I'm sure you see the thunderstorms going through, so power has been going in and out for a variety of people. Hopefully you can hang in there for the next hour as well as we work through the program. So thank you on behalf of the School of Education and Capital Region BOCES for joining us this afternoon. Just a couple of reminders. There are some great resources out by the university and Capital Region BOCES, aligned, standards aligned, curriculum opportunities for staff, for teachers that want to be engaged in remote learning. I would encourage you to see remoteed.org through the University of Albany, which is a great procurement of lots of resources, and we're proud to be working with the university on that, and the essentialed.capitalregionboces.org website. That has been put together by the 24 school districts in our 4 counties, led by our Deputy Superintendent, Lauren Gemmel, to put resources together, standards aligned resources together for students at all grade levels. Jerry, if you don't mind. Fabulous. This is the 3rd in our series of community conversations, leadership conversations that have been going on all summer. Thank you to the School of Education for all of their work putting these together. Attendance has been great. You see we have a variety of topics. Upcoming, there's sessions on stress and collective trauma, teleteaching, where we're going to be featuring the New York State master teachers leading that program, and all of the work that we've been doing with Leading in the Time of Change series as well. So I encourage you to please keep your eyes open for the upcoming series. Join the university, join us in talking about these important topics, especially as we look towards the fall and we look towards reopening. Also, there is a series of summer camps and workshops that you'll see up there on the screen. Very low cost, great opportunities for students. I encourage you to take a look at those as well. And at the Capital Region BOCES website, you can see the camps that we are running with Albany Can Code for children. So I encourage you, again, if anybody needs tremendous opportunities for daycare, or you need summer learning camps for your son or your daughter, these are great opportunities to participate in all of this work from anywhere throughout our region. And just as a reminder, as I previously mentioned, July 23rd, the next session is coming up to continually talk about schools reopening. You may or may not have seen today the governor's daily dose of press conference. There was a lot of discussion about now there's a timeline regarding guidance, regarding opening, regarding may or may not open, all the other pieces regarding plan submission. All that is on the table over the next 6+ weeks. So there's lots of work to do in that area. Reminders about cyberspace, cybersecurity, that's on August 6th. That's always an important topic, as everyone knows, for children and adults. Online predators are always a problem, and everything that we do to keep our children safe in a remote learning space is very, very important work. And on August 13th, the psychological aid, support services, et cetera, for students and staff regarding everything related to COVID-19 and managing different situations in the mental health of your colleagues and the mental health of children as we continue to work through the crisis. And now I would like to turn to my colleagues to introduce themselves. And if you don't mind, we'll go clockwise and start in the upper left-hand corner with Jen Bennett.
Good afternoon, everybody. My name is Jennifer Bennett. I'm the Director of Health. Well, that's actually not right. I'm the Director of Management and Administrative Services for the BOCES. I oversee about 9 different services, one of which actually is the Health Safety Risk Management Service. And in addition to that, I also have internal administrative oversight for all the safety and health initiatives and programs at the BOCES.
David?
Hi, good afternoon. My name is David Haldgrave. I'm the Dean of the School of Public Health at University at Albany. Been doing public health work for about 30 years or so, and most of that's been looking at infectious diseases, especially HIV, and we've been very heavily involved in the COVID response. So I don't bring K through 12 expertise, but happy to be part of this conversation and hopefully contribute a bit on the public health and infectious disease front.
Great, thank you, David. And Stephen.
Hi, good afternoon, everybody. My name is Stephen Kennard. I'm the emergency manager for the University at Albany. My focus here is for all students, staff, as well as faculty to really make sure that we are prepared as well as informed. As Dr. Dragone had mentioned, stuff changes daily in regards to the governor as well as guidance from CDC and WHO. So part of my job is to make sure that we have all of that information up to date, getting into decision makers. So very happy to support K-12 at this as well.
Great. Jerry, I will turn it over to you if you don't mind, and we'll start walking through today's program.
Certainly, thank you. As experts in your field monitoring this pandemic, can you give us an overview of how we got to where we are today and how you are thinking about how things might evolve across the summer and into the school year? And I'm going to ask David to lead this particular question.
Thanks very much, Jerry. I'm happy to start, and I would maybe make first a comment about epidemiology and then a little bit about sort of scientifically what do we know about COVID and where we're at. I think in terms of the epidemiology here in New York, we find ourselves in a much better place than we were, of course, a few weeks ago. If we think about new cases, hospitalizations, deaths, we've gone kind of across the top of the mountain, and we're coming down on the other side, which is terrific. And when we think about deaths, for instance, in New York State, we were at almost 800 per day for a time, and now we're kind of between 8 and 15. And every death, of course, is too much and to be honored and to be mourned. But that's a major difference from where we were. And also, if we look at the positivity rate of just how many people test positive over how many people are tested, for the whole state, we were getting pretty close to 50% people testing positive for a time. And now we're hovering around 1%. Some days it's a little less, and some days it's a little bit more. And so that's really also a really important area of progress. And if there's one metric I always try and keep an eye on, it's that positivity rate. You want to keep the number of tests up, and you hope the positivity rate stays low. But I would sort of liken it, though, to there's kind of imagine a patient who had an open wound, and you're applying a tourniquet to it, and you're trying to keep pressure on that to kind of keep the bleeding from stopping. And I think that's kind of where we're at in New York. We have a very careful reopening, a slow reopening, which is important. People are somewhat wearing masks. There's some social distancing. People are trying to practice hand sanitization and other kinds of approaches. More testing is available. But we need to keep that pressure on. So with that 1% positivity is a function of continued pressure, I think. And different than some other areas of the country like Florida and Arizona and Texas, where we're seeing really major spikes in numbers of new cases in some of those states. So we're fortunate in some ways in New York that we've experienced a really difficult time several weeks ago, but things are improving. We just have to keep up the pressure to stay where we're at. And then the second thing I will say and just stop is that when I used to work at CDC in the 1990s and early 2000s, we often would say in public health, what do we think and what do we know? And since this is a novel coronavirus, we're learning things all the time. And a good example of that is, what do we know about airborne transmission? That's really a major question out there right now. And a number of scientists have signed a letter saying they think the evidence is that there's increasing evidence of airborne transmission, and other people are still trying to kind of gather information about that. And what does that mean in terms of our ventilation systems, the kinds of filters we use? But certainly it means that the masks are incredibly important, and if anything, continue to be more and more important over time. I think in the category of things that we know are certainly the evidence around disinfecting surfaces, hand washing, not coming to work or school if you're sick, social distancing, all have good bases to them. And then I think another area that we're learning more about over time is there's a great article in Science about this in the last couple of days with schools reopening, as what do we know about infections among children? And there seems to be some evidence that children are not infected as quite a high rate as adults, but it also seems possible that they may transmit to other people and to adults over time, even if not quite as high of a rate. And then the severity for children doesn't seem quite as high, but there are some instances of these unusual syndromes, like the multi-system inflammatory syndrome in children, or MISC, or MISC for short, that you've heard about, and a very serious syndrome with about a 2% fatality rate, but seems very rare for when it does occur. So I think we're learning even more over time about the impacts of COVID-19 in children and transmission among children and to adults and their families. So let me stop there, Jerry, and turn it back to you.
Very helpful information, David. Thank you. Stephen, do you have anything you wish to add?
I just think last time that the community at large had seen this type of a disaster, again, as mentioned, has been quite some time. So in regards of the system being able to support, as Dr. Haldgrave mentioned, it truly does require the whole community coming together to make sure that we can maintain control and containment as best as possible. We'll go into that in some other questions, especially with plans.
Thank you, Stephen. So I'm going to move on to question 2. Based on the current guidance for other industries, what are you anticipating as training requirements, and what will need to be covered before staff and students can return to schools? And this is a 2-pronged question. So also, what preventative and proactive health and safety measures are schools taking to educate parents? So I'm going to ask Jen if she'll address this particular question, or I should say questions.
Sure, I'll take a crack at it. So, you know, in terms of training requirements, I don't think there's any big surprises here, right? It's things we're already doing and things we know to do as just the community at large. But several topics that I think are going to definitely need to be addressed prior to schools opening is, you know, one, obviously, proper use and maintenance of personal protective equipment. And again, a lot of this presumes we're coming back to brick and mortar, which is still remains to be seen. But certainly there's the use and maintenance of personal protective equipment. Proper hand and respiratory hygiene. That's certainly going to have to be addressed without a doubt. Reminders about social distancing, and that's going to be especially important for students, especially young students. It's going to be a challenge, but you know, I think we're going to have to make sure that there's just constant reminders, signage, all sorts of things throughout the school to help remind folks about keeping a proper distance away. Certainly, I think one of the biggest things that we are talking about in our training internally at the BOCES is, you know, just largely it boils down to having professional and personal courtesy for each other. You know, it's everybody's job to keep each other safe. And so I think if you go into it with that attitude, and if you're sick, stay home. That kind of a thing. Wear your mask if you can't maintain 6 feet or appropriate social distancing. It's just common sense, really, and that's ultimately what it boils down to. I think the other big thing is, you know, certainly going to be training on whatever health screening application or questionnaire that your agency decides to implement. Certainly people are going to have to be trained on when to do that, which is going to be every day before they enter the building. How to do that. You know, again, I don't think there's any big surprises here. Nothing we all haven't already heard. And we have already at the BOCES begun the training process with our non-essential staff coming back into the buildings just this past Monday. I don't see that changing for our 10-month staff once they return. We've also done it for our ESY staff that are back. I don't see that changing in September. And we also have created a an all-worker training that our health safety risk service is delivering out there to our customer districts. In terms of preventative and proactive health and safety measures for parents, I don't see schools really doing a lot different than they already do. I think our schools already do a really good job of communicating with parents, and they do that through a variety of means, whether it's through their websites, text messages, emails. I mean, I can say from my own local school district, I probably get 2 to 3 pieces of communication from the district every single week, and I have throughout the whole COVID process. So I don't really see that changing. I think that'll probably be very much the same. So, David, I don't know if you have anything to add to that.
No, very much agree, Jen, with everything you said. And I think you're exactly right that the challenge is going to be the details of the how-to. We kind of know the different areas like social distancing and hand washing and so on that are really important. The challenge is what's the flow of that going to look like in the classroom or as people are entering or exiting the school? And it's almost like one procedures manual after the other that one has to come up with of how will that flow, and then how will we train people in doing that. And I know, Stephen, you've done a lot of that work in emergency preparedness. I don't know if you want to expand on that.
Sure. I think one of the main parts here is just making sure as entities, districts, and institutions that you have a baseline that is founded in the guidance we're receiving. And as stuff shifts daily, this is one of the parts to those of us as trainers, this has to also update accordingly. So what we've done at the University at Albany is pretty much centralize a lot of our training to be very generalistic. Here's what physical distancing is. Here's the type of a face covering. Here's what we're asking for. And for instance, on face coverings, we're asking everybody, if you're not in an individual office or your dorm, you have to be masked because the potential to come into contact with another individual is too high. So that's just kind of a general statement. It's obviously backed by the governor's executive order, but we're looking at that as a conformity. Enforcement to your entire population shouldn't be looked at as your end goal. So I think part of the training needs to be very realistic. We're having communications weekly, both with our faculty, staff, as well as our students, to really give them that opportunity similar to this of ask some questions. Let's really work through. The training has to meet your needs. So when it comes to that, we've made a very simple training, and we're going to follow it up with some potential short videos, less than 2 minutes each, that can be absorbed by both faculty, staff, as well as students. For instance, how to properly wear a mask, not below your nose, stuff like that, to kind of give the common sense approach that we need in the pandemic.
Thank you, Stephen. So I'm going to go to question 3. And what are the current requirements regarding screening, and how are schools preparing to address that mandate? And I'm going to stop sharing my screen, and so that Dr. Dragone can share his.
Great, thank you, Jerry. And just to preface, the screening piece is really important, and there's a lot in the guidance about which ways this can occur. And for folks that are running summer programs like we are, extended school year programs for special education students, what we have done is all the children, even though it's optional, we require all the children to screen too before our staff meet with them to provide services, and the parents screen on their behalf. So, I mean, it's really twofold. One is, just to the earlier point, is to make sure that we are doing everything that we can to keep each other safe. And the second part is it's important to know where and how, and all these pieces go together as we begin to have more and more folks commingling across various aspects of each of our businesses. And ultimately, we have a very simple app that we put together that many of our school districts are using. You see a lot of them are populated here. You pick who you are, and our parents do the exact same thing. And when you scroll down, these are the things you need to attest to. These are things that are outlined in the governor's guidance. They're outlined in the DOH guidance that school districts need to follow. If you work here, you pick where you are. If you're a child, you pick where their location is for that. And then you're an employee, you're a guest, or a student. So again, if you're a parent doing it on behalf of a child, it's very simple. And it's the 3 questions that I have to attest to as we always go. And it's about symptoms, it's about close contact, and it's about diagnoses. And if it's no, you check also certifying that you are doing, if you're an employee, you're doing what has been outlined in our trainings and our safety protocols. You're a guest or a student, you are doing what's necessary as well, and you're following the practices outlined in all the safety protocols as well. You fill your name and your email in, and then you get a response that says it is okay that you enter. As simple as that sounds, it allows us to make sure that we are keeping track of everyone, and also, which we have been emphasizing, is that it's everyone's responsibility. We have things that we need to do, and that we make sure that we have in place that Jen really discussed in detail. But it's everyone's responsibility, and the responsibility of the employee, the responsibility of the parent for the younger children or the child for the older ones, is if you want to participate in services, you also have to make sure that you are taking the time before we send our staff out, so we know that they're in a safe environment. And we've had 100% participation from all of our students. The application that we use generates reports every morning. We know who has gone where. If it's a negative report, that goes immediately to HR, and we have the separate protocols in place to deal with that. So I just really want to underscore that, and it's not just us schools or higher ed or anything like that. These protocols are supposed to be for anyone returning anywhere. These are phase 1 protocols. If you're going back, you need to be making sure that folks are testing as they enter to any of the spaces. And those are off the general office ones, but again, it applies to everything. So we, as a region, and we're seeing folks implement the tool that we developed across the state, what we're trying to do is just, make it easy for all of our districts to have tools in place without recreating the wheel 100 times, that are reliable, they're affordable, they're effective, and to make sure that we're supporting everyone doing their part from making sure they know who's in their facilities, who's been approved to be in, and where there might be problems going forward.
Thank you, Joe. Jen, site safety plans are required for all current phases. What is needed to be included as part of those plans?
Sure. So, at the BOCES, we've made a very deliberate decision to follow the New York State business reopening plan template. We've encouraged our districts to do it as well. And again, this is for right now, right? We opened as part of phase 4. I think sometimes the opening in September, whether or not schools are going to open, still remains to be seen. It's going to be separate and apart, although I assume that many of these elements are going to be part of the school reopening, plans as well. So for us right now, in terms of the reopening plan, a couple of things. One is you must have designated a health screening and also a site safety monitor. So those are folks that have very deliberate and specific responsibilities as part of your plan. Making sure that all the employees are completing the health screening process and making sure that the necessary follow-up associated with the health screening process is carried out. And then in terms of the site safety pieces, just making sure that sort of all of these other things that I'm going to talk about are in place. So a couple of different topic areas that should be covered by your site safety plan. One is obviously the physical distancing piece. How you are going to execute making sure that people maintain a safe distance from each other, and if they can't, obviously what needs to come into play. What we have done is obviously we have encouraged, the first thing we've encouraged is that if people don't have to come to the office and if they can work remotely, they should do so, right? And they should continue to do that. The second thing that we have done is if you need to have meetings or, limit in-person interaction as much as possible. We are still largely encouraging that. If you have to bring people into the office or you need to be in the office to conduct a meeting, if you can do it in a larger conference space where you can maintain 6 feet of distance from each other, great. If you need to do it in a smaller room, we have actually posted maximum occupancies on everything. So for the smaller rooms, it's generally like 1 to 2 people max in our smaller conference spaces. So it's all of these things that go towards maintaining the physical distancing, right? Another topic area here is obviously personal protective equipment. where people can get it, who's going to provide it. I mean, as the employer, we are responsible for making sure it's available if people need it. In addition to that, how to properly use it, how to properly maintain and clean it. That's all part of it. And again, that all goes towards the training that we have conducted as well. So PPE is another area that's, again, that's going to be part of any site safety plan. Again, it goes probably hand in hand with the next topic area or next area for the plan, which is going to be cleaning and hygiene in general, right? So cleaning has been bumped up a little bit. So maybe you were at one time cleaning once a day. Now maybe you're doing it twice a day or at the end of every shift, so that's obviously been increased to some degree, making sure that frequently touched surfaces are cleaned more frequently. Again, this is all common sense. This is all things that we have heard about, but it just, you need to put paper to it, pen to paper for your plan. Communication, again, making sure that employees know what the expectations are, what we are doing to ensure their safety. And this all goes back towards the training, and certainly, making sure that you have a communication plan in place. That's not going to change for parents once school starts with students. Right now, we're focused mostly on staff and visitors to our buildings, but it's don't overlook visitors. It's very important that any visitors coming to your building are included in all of these elements and have the proper information that they need. So that's something else certainly to consider. And you need to make sure that you're also keeping a visitor log. We are making sure that we do that as well, so that should anything happen, we have the ability to go back and contact folks if we need to. And we've already talked about the health screening piece. So I think those are the main components of what you'll be looking at for site safety plans. Again, I don't know if anybody else has anything to add to that, but those are probably the top things.
Thank you, Jennifer. I saw you shaking your head with an agreement, Stephen. Do you have something you wish to add?
No, I think those are the main points when you're talking about an emergency plan that's supporting a very fluid response. It's covering the main areas based on the facts that we know, similar to Dr. Holtgrave's piece. What do we think we know and what do we actually know? And that's the part, especially in regards of mask wearing, distancing. These are requirements for us to have. So especially Jennifer, those visitors. We at the university are still finalizing how this looks like, as well as events we're having. So incorporating that, especially a thought of how you will be communicating with those groups, is crucial. And especially that listing assist with any type of contact tracing efforts that might be needed. And that's why we ask everybody, it truly is all of our responsibilities to remember where we go, when we go, just as best to assist in that process from our settings.
David, do you have anything you want to contribute?
Oh, just one thing. I agree with everything that Jen and Stephen have said. And just to mention a document I think probably many people are already familiar with on this call is CDC has a document called Considerations for K-12 Readiness and Planning Tool. And it's quite an extensive tool, and it divides the plan into sort of three parts: policies and procedures, things like making sure you have a connection with the health department, you know what the background epidemiology is, what's the sick leave policy for students and faculty and staff. Second big piece is the facilities and supplies that we have talked a lot about. And then the last are education and training. And I would sort of call that a kind of a communication plan there as well, too. So I just wanted to mention that additional resource from CDC. It's available online, and it really quite an extensive document. And interestingly, what wound up being discussed a bit in the news today around the breaking news stories about schools reopening in the fall. So I just want to mention that.
Thank you. I appreciate that. I'm going to move on to question 5. Do you anticipate a requirement regarding contact tracing? And I'm going to ask Joe if you would lead that.
Sure, thanks, Jerry. And this alludes to a little bit what we've been talking about here. And to the point that was raised regarding visitors and those pieces, contact tracing per se that you hear mentioned a lot by the governor and in the news as a program is formally run by the state and run by the counties, by the folks that they have in place to do that work. But the thing is this, if something's reported and they say they've been to, they worked at Capital Region BOCES on Thursday, something came into the county's doing contract tracing, they reached out to someone, they said they were at a school, they said they were BOCES, they said they were anywhere. They call here to our health screening monitor and they say, we had a report that someone's there. Then in terms of contact tracing from the site side, which is really what the site managers and the health screening monitors need to be accountable to, when that call comes in, we know who was in when, we know what visitors are in when, visitors leave the literature, what they need to do. We know how to contact anybody at that time. And that is really the important part. So it's a contact tracing point with regard to having the knowledge and the ability to reach the people that have been in the facility. So it's it's really an extension of the formal program, but the onus is on the responsible party, quote unquote, as they refer to it in the guidance, which ultimately is if you're in a space that you don't own, the folks running the programs there, or if you are your own institution, you are the responsible party. Schools, obviously, the district is the responsible party. It's a district level, it's not a building level, but you need to be able to reach out to those folks or provide anyone with those folks of who was there on any given day so that they know, the probability of where they were when they were here. That's something that the county works through when they have that conversation with the person. But ultimately, we need to make sure we know who's where. And also, if we get a negative or actually an affirmative result from the screening tool, and we need to let people know if they get symptoms over the course of the day, that also has to get reported to our health screen monitor, and we know who's around, who's in the building, who's been through, so we can let those folks know. So it's really, the local responsibility is an extension of the work that's in place for the state, and it's even that more important because on the ground, like everything, on the ground is where the real work takes place. So you need to know who's in your facilities, who's been through the facilities, and who's been really in arm's reach of each other while they've been at work.
I know, Stephen, you've been active in the conversation at UAlbany regarding contact tracing. Do you have anything you wish to share?
Yeah, just a couple points from that, especially just to take what was stated. Pretty much what we're looking at is a contact tracking support. As was mentioned, this is a function of the county through the state's tracing program, and the state has hired enough based on populations within each of the counties submitted. So what we're doing is starting, especially as we have residential population, is looking at what services are going to be needed beyond that tracking ability. So it's informing all of our labs, for instance, if they're having visitors, to have them sign in. It's very different than normal, but it's making sure that if that comes back through and the county reaches out to myself or our health center director with that affirmative test result, we're able to provide information to their tracing efforts and assistance in that from the entity. So that's where you want to make sure as the schools, the piece that you're communicating directly with your county health department. It is a great conversation to have now, especially before you need to have or receive that affirmative call, to know, especially internally, how that's going to process. So for our end, it's been a very open dialogue with the county to make sure that expectations and what we're building and purporting from the university aren't there. We are incorporating students from our schools of public health, College of Emergency Preparedness, Homeland Security, as well as School of Social Welfare, to really support that effort from those perspectives as well, to give the experiential learning that is necessary to the education.
Thank you. I'm going to ask you to lead the next question, Stephen. One area that has been on lots of folks' mind is athletics. And as these practices often start before the actual academic year, can you share some comments on this topic? And I know this is particular to the University at Albany.
Sure. The University at Albany, being a Division I school, works directly in concert with the NCAA and the various conferences we're a part of. The NCAA has come out with recommendations similar to how the state has provided guidance for us. So what we're looking at is pretty much what we're able to do. As the state, the governor's reopening phase 4 plan does not include gyms and fitness centers. This added a slight crux to the plans of reopening. However, what we're looking at is those residential students or those students returning to the area from affected states that are currently under a quarantine, of how do we support that upon return. So locally, my recommendation to you folks is really take a look at what those programs are. Contact sports provide contact that we're trying to avoid in response to this pandemic. So it is very unique, and it is one of those pieces we're considering very gingerly, if you will, as we move forward, because we have to make sure that not only the students are safe, but that our staffers that are supporting them through all of the fitness and different training requirements can do so safely. And that is potentially going to mean, especially just talking UAlbany athletics, that some entities or some activities are going to have to be curtailed. For instance, we have fitness centers that we allow students as well as our faculty and staff to use. So it's not only a distancing, but also a disinfectant of cleaning materials. And again, that tracing element is there if you're going to have more than one person in and out of a space throughout the day. So for athletics, I'd say work coordinatively with your different associations, making sure that you're following the guidance out from the state health department on those activities as they come forth. It's one of the pieces that planning is crucial. We need to make sure that communication is part of that planning, because we have to make sure we're communicating out to the student athletes as well as their parents to understand some of the changes that might be in play with athletics at this time, especially talking of a return to the fall.
Very helpful, Steve. And Joe, do you wish to add anything regarding as it relates to the public perspective of schools?
Yeah, sure, Jerry. I mean, this is so fluid right now for public schools. I see my good friend, Dr. Lori Kaplan, is on the line and part of the meeting. She is a superintendent's representative to the state athletic committee. And it's really the tale of two coins, where you have all the athletic people say, okay, look, we're ready to go tomorrow. And everybody else saying, you might be ready to go tomorrow, but you can't go tomorrow. And there's a lot of pressure on school districts. You may see the guidance now, and it's like, yeah, so my camp can be using my fields, but I can't have a practice. And the answer is yes. I mean, that's just the way it is right now. I find it hard to believe, with the exception of golf, tennis, even to a degree, cross country. If I don't know, those individualized sports, I think probably have a better shot. But we're not even going to know what our status is. My guess it's going to be August 6th or 7th. And I would be surprised if we know about what even is going to happen by then in the fall. So the reality is that's also generally a week before practices start for a fall season anyway. It's at best a coin toss right now. And candidly, everybody's waiting on guidance on a lot of the other pieces. And the athletic people say, we can do this, we can do this, we can do this. But the reality is, there's a lot more going into this, what happens with athletics, than what happens with the education side and opening our facilities and the rest of the pieces too. So it's as Lori points out, and it's a tremendous political conversation. We all know how important it is to everybody, but the reality is, you have to wear a face mask, but you can play football. I mean, you can't have, I don't know how you can have those things simultaneously in effect. So I think how this is going to look is something that all the athletic people are going to have to start coming to terms with, unless something, as far as I'm concerned, at least in my humble opinion, unless something really changes abruptly by the fall.
Thank you, Joe. I'm moving over to question number 7, which deals with loss of learning. Recently, there have been headlines about the need to focus on student learning as we consider our reopening plans, with a clear bent toward in-person learning being preferred. How are you assessing the impact of the pandemic on learning from the spring semester? And how are you balancing student learning and health and safety in your planning? And Stephen, would you mind addressing that question?
Sure. At UAlbany, we have created a COVID-19 task force as well as a Forward Together task force whose goals are looking at response as well as that planning factor. And part of the Forward Together plan was well informed with information directly from student surveys, what their expectation was and how they handled the spring semester. What we've done is tried to incorporate those findings into academic classes that are going to be offered in person as opposed to hybrid or remote options. Again, as an institution, we had online learning, but this is different. This is not a complete conversion to online learning. This is a remote piece. So we're trying to really balance that with potentially synchronous pieces, a meeting in person to have some type of that normalcy that we're having in our abnormal times right now. So I think looking from the university's perspective, and I definitely like to go to Dean Haldgrave on that piece as well, from how they handle that SPH side, but we've looked at that and it's really helped better inform our plans of how we're communicating out to the students to really bring them into the conversations earlier so they understand the temporary nature of this, hopefully more temporary than long term, but that this is what's affecting us at this moment in time. Dean Holtgrave?
Thanks, Stephen. Just a couple of things. I think one is also taking this opportunity to use some of the challenges that we're all facing with COVID-19 and bringing it into some of the curriculum and materials wherever we can. And maybe in public health, that's easier done than in other areas. But we have a lot of students who've gotten very involved in doing contact tracing, doing epidemiological analyses, thinking about how to communicate around issues in COVID-19. And I think in so many disciplines, in so many areas, now it's an opportunity to kind of be challenged by what's going on in the front lines and to kind of bring that into some of the curriculum material. And of course that works better in some grades than others, of course. And the other thing I just would say about this balancing issue is I think it's really important to have some metrics that you lay out in advance. And for the state of New York, you've seen in many of the governor's pressers the dashboards with the little gauges and the dials that he uses as an analogy. And I think it's really helpful because now we can look at every day in the state, how are we doing by region, by area, in terms of positivity rate, hospitalizations, fatality rates, sadly, and so on. And it gives us a sense of if things start to move in the wrong direction, how can we kind of go back a phase or two if we need to, and how can we address that? And I think that's true. That dashboard idea is relevant to universities and colleges, to K through 12 schools. I think for all of us agreeing on, for our local institution, for our organization, what are the key metrics we're going to keep an eye on, and sort of knowing that every day we're going to, or maybe every week, look at those and say, if they start to move in a direction we're not happy with, what action are we going to take? So I think that the more data-driven we can be, the better we can inform that balancing act that's so important.
Thank you, David. Joe or Jennifer, do you wish to weigh in on that?
Jen, defer to you if you have something to add.
No, I think they covered it all.
Agreed.
Sounds good.
I'm going to move over to question 8. And how will schools communicate with parents, teachers, and students about the 2021 academic year? I know, Jennifer, that you addressed that in your talk earlier. Do you have anything you wish to add to that section?
I don't think so. I mean, I'm not a communications expert. But no, I mean, I don't see it changing very much from what they're already doing in terms of, website posts, automated text messages, there's all sorts of things that I think the other thing that I've seen too is that schools are certainly trying to involve parents to some extent in the reopening process, whether that be including them in committees or task force. So that's certainly part of it too. But.
Thank you, Jennifer.
Mm-hmm.
Stephen, I know that the University of Albany has been very active in making sure that they've been communicating this information to faculty and staff and students, and they've done an excellent job. Can you share a little bit about that?
Sure. We really kind of have been looking at our communications as twofold: risk and crisis. Crisis is that emergent, you get an emergency alert to take shelter. There's a storm, for instance, outside right now. So we're also providing our community the differentiation of that by doing these risk communications to the community. Parents, here's your concerns, and we have parent town halls. So I think diversifying the type of communication to them and using the right mediums. For instance, our students are very much on different platforms than their parents, than the university. So we hit multimodal. Email is still the main piece of where we provide out general messaging. We also utilize YouTube, Instagram, numerous different platforms for visuals. But as we all know, some of them are based on pictures more than written word, like Twitter. So we're trying to really utilize all forms to provide the message out consistently. In a normal emergency, that's a time-bound emergency. You would be having, for instance, press conferences at such a time, at such a piece. And we've seen the governor utilize that. But for these schools reaching out, I just recommend maintaining that. Make sure that you have open lines. If you're not sure if they know, The assumption is probably they don't. So more information is better during these times, but again, make sure it is the correct information. And sometimes just stating there haven't been any updates is enough of an information coming out, especially the fluid situation. Hopefully most folks haven't had a vacation under a remote area rock and might not have received what's been going on this summer with information. So to Dean Holtgrave's point, the dashboard helps inform that. So here at the university, we're similarly looking at different ways of taking that information and feeding directly into our response plans, especially if we're starting to see outcomes we're not comfortable with, how decisions get made. So that's also part we're communicating with faculty, staff, students, and parents of, we might have to adjust again. So please make sure, number one, you're paying attention to our website. That is the most up-to-date core of information from the university. Then you're following in on any social media norms, as well as any email. Not everybody reads email, so we have to just understand that we have to use multimodal for communications.
Thank you, Stephen. I also have found that the webinars and Zoom sessions that we've had to be extremely helpful. And it also allows for an exchange to occur. So I thought I'd share that as well. Moving over to question 9, I'm going to direct this question to David Haldgrave. What equipment and other resources are available or needed to make learning more equitable and accessible?
Oh, thanks, Jerry. You know, I think probably the most comprehensive list that I've seen is the CDC K through 12 document that I mentioned earlier. They go through quite extensively. And, you know, for myself, I was jotting down a few of the items around this question before. And, you know, the list gets quite long quite quickly. And Stephen and Jen and Joe may want to add to this, but, you know, it's, if we need to have different kinds of filters for air filtration system, masks, sanitizers, soaps, disinfectants, signage for the schools, different ways of encouraging social distancing, whether that's like taping off areas of the floor or playgrounds or moving desks around and so on. The number of pieces of equipment becomes quite large quite quickly. And again, I think the K through 12 document from CDC is probably the most comprehensive list I know. But thinking about what the supply chain of that is going to look like, getting all the orders in, and making sure that that's well stocked over time. And then also kind of going back to the communications question, making sure that there's campaigns in place for encouraging the use of that. And I know well before COVID-19, when I used to be at Johns Hopkins in the health system, there was an attempt to encourage people to wash their hands to reduce the number of infections in the hospital and in the health system. And to get people to wash their hands, there's a really comprehensive campaign put in place, and it was branded. So there was one glove that was similar to all the ads, and the look and feel of the ads were all the same. But some people wanted to hear from the dean of the medical school. Some people wanted to hear from union leaders. Some people wanted to hear from physicians and nurses and other healthcare professionals. Some people wanted to hear from patients who said what that hand washing meant to them. And I thought it was an interesting campaign because it had a common look and feel. The message was kind of the same, but the messenger differed from ad to ad. And it wound up being, I think, a really successful way of thinking about how to communicate. So all of these things that I've listed, all the things that are in the CDC document, including different kinds of disinfectants that have now been approved and so on. Then there's the question of how do you use them? And I think that really kind of blends this 8th and 9th question together. But I don't know, Jen, Joe, Stephen, if you want to add to that.
Oh, I just certainly won't add, David, but concur 100%. I mean, it's just a lot of challenges along those pieces, and frankly, we keep learning more as we're going through it as well. So I think managing all of it is part of the challenge, just as much as responding to everything as well.
Definitely, I'd say the only point to really add into that is be unique. These are the opportunities and times that you might need to think outside of the box more than not. Again, this is an unprecedented piece, so how do we connect our students into the academic learning that is truly the goal we're trying to provide them? And it goes beyond just the physical hardware, the computers, the access to the internet. Those are pieces that are crucial to maintain remote learning. So then when we do a return, we need to consider what is necessary for changes in the building. And Dean Holtgrave mentioned that specifically. We've removed a lot of furniture for our campus center. If you were to walk through right now, it would not look normal to anybody. Our dining halls are very different, of more of process, come, collect, and leave. So thinking really outside of that, with the number one goal for health and safety needs to be paramount for this response above all else. And I think through that, you're able to identify resources, but definitely Mr. Dragone's point is, it is very difficult. So we just have to be very fluid and appreciate everybody's flexibility through this.
Well, thank you. I'm going to see if there are any questions from our guests today. I know that there have been questions that have been surfacing in the chat section, and they've been being addressed by the presenters. Any other questions? I'll take that silence as a no. And so with that, we want to thank our presenters today